Okay, hello everyone, and welcome to the webinar on the Cigna Dental Innovation Studio, the tip of the innovation spear. So if we haven't met before, my name is Brent Rossum. I'm Cigna's National Account Sales Dental VP for the West. I'll handle a handful of logistical items here before we get started. First, a recording and a copy of the presentation will be shared with the attendees post-meeting. We'll address questions at the end of the session here. That said, during the presentation, should you have any along the way, you can easily submit those via Slido, and then we'll answer those in the time allotted. Before we pass the stage to our guest speaker, I'd like to introduce my colleagues, Gene Urballo and Jeff Heyman. For those who don't know them, Gene Urballo is our dental sales executive for Southern California and the Nevada markets in the 500 to 3,000 market segment. And Jeff Heyman in the same territory is responsible for the 50 to 500 market segment. So we appreciate your time and interest, and I'll pass the mic over to Gene to get us started. Thank you.
Great. Thanks, Brent. And thank you to our guest and for your time today. I'm really pleased to introduce our speaker, Eric Kirchner from the Cigna Competitive Intelligence and Innovation Development area. Eric currently serves as in a dual capacity, working with innovation, products, and partners, and providing competitive intelligence to us. Eric has worked in product management, sales, national account management over 2 different stints with Cigna. His background includes positions as national sales leader for General Electric, chief operating officer for Bombay-based HIV/AIDS charity known as Christ Hope International, and marketing roles in major insurers such as Prudential, Blue Cross Blue Shield of Illinois, Delta Dental, Insure One, and Allstate. So with that, welcome, Eric.
Thank you very much. I appreciate it, Gene, and thank you for the wonderful introduction. And I want to talk today about dental being the tip of the innovation spear. And what do we mean when we talk about the tip of the spear when it comes to dental? I think of this as something that with dental, you have the opportunity to be able to have a proof of concept that you can easily translate to something like medical or other products. So really you can test and learn on the dental side and then have the opportunity to scale that to medical. And a lot of times startups and people who are trying to make a difference in the overall healthcare industry will start with dental because it's very manageable. It's a network-based product and also has a lot of similarities when it comes to how claims are processed and things like that. So let's talk a little bit about the Dental Innovation Studio that Cigna has stood up. So one of the things that is important to realize when it comes to what we've been putting together is that this journey really began, even though we only started this formally about 5 years ago, this journey has been going on almost 10 years. And as part of that, we've really tried to build a process when we think of innovation, how we're going to bring innovation to our customers, what kind of things that we're going to be looking for these type of products that are going to make a difference to the health and well-being of our customers. So I think the first thing that we really look at is scanning the market. What's going on in the market in terms of what kind of up and coming innovation trends, startups that have started, coming into the industry and are bringing different looks and ideas to dental care as well as medical care, and some of those things are going to cross over. So we want to look at all the things that are happening in the industry, and we have put some partners together to help us to track what's going on so that we have a really good feel for the opportunities are out there. And then we look at those opportunities and say, hey, which one of these is going to bring the most value to our customers? And when we speak of value, it's going to be the first and foremost thing is it going to improve the health of our customers and their access to care? So that's the first thing. But also, as part of that, from a value standpoint, is this going to help us not only to make people healthier, but is it also going to help them to reduce their costs, to reduce the hassle, to give them opportunities to access care that they might not have had before? So those are the kind of things that we look for. And then when we find a company that we think has a solution that fits the model that we're looking at, then we want to go and spend some time with them, vet them, make sure that that all the things that that they're trying to get done are things that fit with our vision, and then we try to go into pilot mode. So from a pilot standpoint, we want to be able to design pilots that are going to be something where we can test and learn quickly. So we want to rapidly pilot. We want to be able to get results. We want to make understand what we've learned from those results, and then iterate and potentially start scaling that type of program. So really the important thing with piloting for us is we need a client or clients that are willing to work with us and say, you know, they're willing to lean in on the innovation side, and we work with them to put a pilot in place. We'll have it for a finite period of time, and when we're complete, we'll kind of go into that third phase, which is that kill, pivot, scale type of situation. I'm sure many people, but not necessarily everybody, is familiar with Agile methodology. But in Agile, they have this saying that sounds, pretty tough, but I think it really helps with us in determining how to go forward with pilots, and that is be able to pivot without mercy or guilt. So we can look at something and say, okay, we piloted this. We came in with a hypothesis that said, hey, this product or this service is going to make a difference for our customer. But when we tested it, either, we didn't get very good results, didn't meet the hypothesis, was not well received by our customer or our client. And we have to be able to say, you know what, that didn't work out. Let's go on to the next thing. If there's opportunities to iterate on that and say, okay, well, this didn't work, but something else might work, then let's test and learn. Let's get out there, rapidly prototype something that can go out there and test that new hypothesis, but be able to walk away from something if it's not going to work, as opposed to kind of continuing to bang the head against the wall. And a lot of times what we find, and I'll probably hit on this a little bit more as time goes on in this presentation, but there's a huge difference in what we think the customer wants and what the customer actually wants. So from our perspective, we have to do the homework and find out what the customer wants. And some of that's going to come previous to the pilot. And we have some tools that we use to be able to find out what people are thinking, what they want in a product or a service, so that we have a better idea, so that when we build it, it's going to be a better fit for everybody involved. So I'm going to move forward here and talk a little bit about some of the players that we work with. And this is just to try to give you a feel for, this is the type of environment that we're in. Again, like I said before, we do that market scan and we see who can play and help us with our mission to improve the lives of our customers and to be able to drive down costs while driving up oral health. So we'll go through, we'll look at the market, then we'll bring the ones that are most promising in and test and vet those capabilities, and then go and pilot with our clients, but also working with these partners to develop a better product. So we go really kind of run the gamut from a dental perspective of saying we're looking at innovation acceleration, and I can talk a little bit more about that, but in a sense, what innovation acceleration means is being able to help us identify the players out in the market that are worth looking at, giving us some idea of what the trends are, and then also giving us an opportunity to actually check with customers and find out, what's the customer thinking? What does the customer need? How do we meet their needs? And then we kind of leverage that information into three main areas. One of those is access to care, because that's important. A lot of people have a hard time getting to the dentist, and there's a lot of barriers when it comes to going to the dentist, that people are a little bit afraid. It's difficult to do. I don't have the time, whatever the situation is. We want to make that access to care as easy as possible. The next piece is provider focus. So our providers and our network of over 140,000 providers, we want to make sure that working with us is as easy as possible, and that we're also providing the tools to our providers so that they can do their job as efficiently as possible. And then the other big piece to this is at-home care. So from an at-home care standpoint, we want to make sure that we're putting the right tools in our customers' hands so that they can improve their oral care regimen that 363 days a year that they're not in a dentist's office getting the exams. So that's the way that we look at how we have that holistic approach to oral care. This next slide gives you a feel for the timeline that we've gone through so far. It started in 2016 when we started working, actually a little bit before that, with Brighter, and eventually acquired Brighter. And then pretty soon after, we started working with Innovation Accelerator Pilot 44 that helped us to get a better view of the market and led us to some, some potential partners that we can work with. Since then, we have really, blossomed in looking at a lot of different players in the market, mobile dental. We started doing teledentistry, and we're the first to have a product in market, and right timely as far as the pandemic was concerned. We've worked with a lot of the major at-home care players, Procter & Gamble in their Oral-B line, Philips, Colgate. All of those are companies that we actively work with and try to bring solutions to the market with them. And then more recently, dental-focused venture capital firms that are another great source of not only information about what the trends are and where the opportunities are in the market, but really for our standpoint, it's also an opportunity to have opportunities to put money behind some of these innovations that are coming onto the market from a Cigna Venture standpoint. So we've really spent a lot of time trying to assess the market, bring stuff to market, and it's made a significant difference in how our dental mission is presented to our customers and the things that we can do to make our customers and our clients happy with their dental care. Um, I'm going to talk a little bit here about some of those areas that we focus on. So I think the first one is exploring a better home care experience. I think that the important thing with the home care, again, it's that 363 days that people aren't in the office. What can we be doing to give them the right tools to be able to be effective when they're doing work at home on their smile? So I know for a fact that if I put a power toothbrush, particularly a Bluetooth one that can help people actually figure out where they're brushing in their mouth, the areas that they're missing, that their oral health is going to improve. And somebody who has had oral health problems, if you give them one of these brushes, it can help remediate a lot of those types of problems. And what we get when we're done with that aspect of that home care experience is that we're trying to make sure that we're increasing the healthiness of the customer and the healthiness of their smile, that their oral care is in good condition. That's going to be a positive for the customer. And at the other end of the spectrum, for the client as well as the customer, the opportunity of taking care of their teeth is going to drive down dental costs. So there's a direct correlation in what people, if they're taking better care of their mouth, they're going to be needing dental care less, which means that everybody saves money. Moving over to the right, expanding the focus to bring more solutions to our customers. This is an important thing. So we talk about in the dental industry, how do we help the most people all the time? But there are significant carve outs and niches of people that require specific types of care. And quite frankly, from looking at the market, what we found out is that our clients and customers want more capabilities out there to be able to handle some of those niche audiences. One of those would be, certainly for seniors to be able to give them the tools, and those tools might be different across, somebody who's in Gen Z versus somebody who's a senior. Give them the right tools so that they can take care of their teeth and keep their teeth. And then another important piece of this is people who are on the neurodiversity spectrum. So people with autism, and this is something that I found out and learned about as time went on, was that that population has a real hard time with teeth cleaning, and it's going to change based on somebody with autism, if it's really pronounced versus not as pronounced. The difficulty in caring for the teeth for those people can be pretty variable. So finding solutions that are going to address those types of things is something that's important to us because it's important to our clients and our customers. So that's definitely something that we look at. In the bottom right, we talk about identifying more ways to access care. Care is a very difficult thing, to be able to do if you're in a care desert. So if you're on the south side of Chicago in some of the neighborhoods where a dentist is not available, or you're in a rural environment where the choice between dentists can be, anywhere from 20 to 30 miles, or you are somebody who has, concerns about going to the dentist in the first place. Hey, I'm scared, or I haven't been in a while, so I'm a little nervous about what's going to happen. We have to find ways to be able to serve all of our customers. So some of the things that we've implemented, and it has made a significant difference already, is mobile dental, where we bring the dentist to the customer or the client's office, and customers can go, during their work hours or after their work hours in a convenient setting for them. We also established teledentistry, and like I pointed out before, we were able to identify teledentistry as a potential way to help get people through the pandemic, and went big on it and saw big returns as a result. And it's now a regular part of our arsenal. But also things like, being able to do oral triage by having people take pictures of their teeth, a guided series of pictures, to be able to look at those teeth, with artificial intelligence, and also with a dentist, and be able to give actual feedback to the customer in a very short period of time, so that they get an idea directionally where their oral health is. All of those things are things that we're doing to try to be able to bring the dentist to our customers, no matter where they are. And hopefully, as we continue, particularly to help populations that are affected by social determinants of health, that's an area where we're putting a lot of our innovation brain power to try to expand the opportunity for those folks. And then lastly, understanding customer needs. And again, going back to something I said before, the difference between designing something that we think people will want versus what people actually want is, so we want to find out what those needs are, and then design programs to be able to address those needs. I think that the difficult thing for a lot of innovations that come to the dental space is that everybody likes to talk about, well, we're innovating, we've got this toothbrush that works and it's great, and you can come to our site and you can buy it at a slight discount or whatever. Um, those are fine, but the actual utilization rate of that is very small. So instead of trying to, basically put window dressing out there and say, well, we've got something, therefore we're in the game, our approach is much different, in the sense of, yeah, we want to be able to make things available to people, but we want to be able to have something that's going to actually work, that customers have told us will work, and that we've tested and vetted. And then hopefully we're going to be able to benefit way more people by taking a more holistic and in-depth approach to innovation than some of the other players in the business. So, and I think the biggest thing, when we talk about how we are successful in this is, again, what are we doing to increase oral health and decrease costs? So one of the things that we've done recently, is in working with our pilot accelerator, Pilot 44, we'll go out, we'll survey the market, get an idea of who the right players are for us to be learning more about, and then bring them in what we call a live lab experience, very similar to a Shark Tank, where we can, get an idea, have them pitch what they have, maybe do some co-creation with them. And several of those have been innovations that have come to find a place as part of our innovation story and what we're giving to our clients. But I think the other thing to keep in mind here is, again, what are we doing to increase health and decrease costs? So you look at the first example here, we started working with Colgate-Palmolive in bringing up a startup called OrisDX. And OrisDX is specifically focused on doing cost-effective saliva tests for oral cancer. That's a niche that's it's not very well covered in the dental community. Part of it is due to time. Part of it is due to accuracy. So, imagine from a dentist perspective, you want to be able to test somebody or look, for oral cancers. But if you're right, that's great. And if you're wrong, you may have, really upset somebody by saying, hey, you may have oral cancer when they really don't. This saliva test is the game changer that allows the dentist to feel comfortable giving a proper diagnosis. And if we identify these things early in the process, we're going to save our clients and customers significant amounts of money, anywhere between $2,000 and $25,000 in treatment costs. Another example is teledentistry and teletriage. So from our standpoint, when we launched Cigna Dental Virtual Care in 2020, we saw, among other things, the opportunity to divert customers from the ER. And so we looked at our own book of business and said, how many of these folks that go to the emergency room, go to the ER, how many of those people actually needed to be there if they're going for something that ends up being coded as dental? The number was astonishing. It was like $60 million over a year period. So by putting teledentistry in, and then again, looking at our customers, getting their feedback about what they've, is this actually helping them to stay out of the ER and the costs that are associated with it? And we saw in 2021, we saw savings of over $5 million just in ER diversion. And again, giving people the help that they needed without having to have them go to the hospital and pay, a significant amount of money for an ER visit. So overall, this is something that, again, improved the health and cut down the costs. And I think that's where, our sweet spot is. What can we be doing to continue to drive those two indicators? Wanted to give you a quick look ahead, and I noticed that we're running a little short on time. So a couple of things that I had alluded to, we're doing some work on neurodiversity with a large oral health company, looking at what we can do to help customers who have ADHD or autism. Looking to pilot that later this year, and then also using artificial intelligence to help us to run claims through, increase the throughput in our systems and limit the amount of human intervention that we need, but also make sure that we're preventing fraud, waste, and abuse. So I would say that, both of those things, there's many more in the pipeline. I can speak to a program that we're working on to bring additional services and capabilities to women who are having a baby, and then for that baby and toddler to kind of give them those first steps towards a lifetime of oral health. That's one thing that we're looking at. And also looking at where the opportunity to cross over from dental to medical, to make sure we have our oral health integration program, which is Cigna was first to market with that. And our oral health integration program is expanded and giving, people, whether they have diabetes or they have heart issues, or, they're pregnant, being able to give them the extra services, because we know that there's a direct connection between what goes on in their mouth and what goes on in the rest of their body. So I'm going to stop there. I want to say, again, very much thank you for the opportunity to talk through what we're doing from an innovation standpoint, and happy to answer any questions that you might have.
Absolutely. Thanks, Eric. For folks on the line, please make sure to just unmute yourself. *6 would do so to answer any questions. And we're also going to be looking through the chat box. Eric, it actually looks like our first question just came through. So the first question is, what specifically is innovation acceleration, and how does that apply to Cigna's innovation work?
That's a good question. So I think, innovation acceleration really means we all in our regular time period, we want to be able to look at the market and be able to identify players that might help our innovation boat go faster, for lack of a better term. But by having an innovation accelerator, I alluded to Pilot 44 before, and we've worked with some others as well. What we can do is be able to do that rapid piloting, so that we are going out, putting a pilot in market, and having some assistance in doing that, so that so for instance, giving putting together a quick app that gives a look and feel of what we're trying to do, so we can test whether the customer is going to respond positively to that or not. That gives us the opportunity to pilot in a quick manner, to learn quickly, pivot where necessary, and if we've reached a dead end, to make that decision that this is probably not going to be a good fit for us. Let's move on to the next thing.
Well said. Thank you. Another question that came through was, does Cigna's innovation work resonate with brokers and consultants as well as clients, or what's been the feedback thus far?
Well, I think it's in an overall sense, I think it has resonated pretty well. Just hearing from salespeople like yourself, I've gotten a pretty strong feeling that our innovation message from a Cigna Dental standpoint is one of our strengths. So I think that brokers and consultants are responding to that. But what we've also seen is actual opportunities to do some co-creation with some of our brokers and consultants. And again, that gives an opportunity for the broker to be able to give their side and their input into what we're doing. And a lot of times it's a very unique viewpoint, which is very helpful, but also gives them a sense to feel like, they can be part of driving what we're all striving for at the end of the day is again that meeting place between increased oral health for the customer and decreased cost for the client.
Wonderful. And just a reminder for those folks on the line, if you have a question, just feel free to *6 and you'll be able to unmute yourself. There is another question in the chat box, Eric. How does
Okay.
Cigna start by identifying startups or new entities that have these capabilities to partner with?
I would say that that really ends up being a continuous process and it happens at two levels. So at one level, a lot of my job is to be monitoring what's going on in the market. And I have a bunch of different sources that I work with. And I mentioned earlier, speaking to VC firms that are looking at capabilities that are coming up. So that really helps in kind of setting the stage. And then that next piece working with our innovation accelerator to have them do a deep dive into the market, look at what's going on and say, what are the disruptors, and we can identify areas where we think there might be some low-hanging fruit. Let's say it's at-home care or it's customer engagement, those type of things. They'll go out and find companies that are doing that and doing it well, and then bring that back to us in what they call a disruption radar, so we can look at not only the players that really fit our opportunities and what we're trying to get done, but the ones that are really the disruptors. And I'll be the first to admit, in innovation, anytime you think you know it all, you don't, because I've found this more often than not is that I can understand that there are certain things in the market, but there's new applications or new ways of looking at it that come to us from an innovation standpoint. And it's helpful to have somebody provide an outside in perspective so that you can do a better job of finding the right fits for our clients and customers.
Thanks, Eric. That's all the questions we have for now. Just want to thank you all for attending today. We really value your time and appreciate your interest in innovation and specifically hearing what Cigna is doing as part of that. Please reach out if you'd like any more information or would like to have a detailed discussion. Thank you so much, and we're signing off for now.
Bye bye now.